Hi, my name is Elizabeth Turk. I'm a Peace USA mission coworker. I've been living and working in Madagascar with the FJKM Church for over 20 years. I am a nurse with a master's in public health. In this session, we're going to look at the impact of COVID-19 in Madagascar and in the FJKM Church. We're going to see how partners have assisted the FJKM and see some examples of what the FJKM has been doing during the crisis and how it has been reaching out to help others. The first cases of COVID-19 were reported on March 20th. The government acted swiftly and instigated a series of drastic steps designed to slow the spread of the disease, including shutting down bus service in the capital city and between cities, shutting down schools and worship services, and calling on people to stay home, wash hands frequently, and maintain a distance of at least 1 meter from other people. Commercial flights coming into Madagascar were shut down on March 20th. Precautions were relaxed briefly in June to allow more movement and small gatherings. Some churches began having in-person services with less than 50 people. They had to abide by cleaning and other preventive measures required by the government. When the cases started to spike again in late June, meetings were banned. Cases reached an all-time high of 614 new cases on July 22nd. Then they quickly declined. Hospitals were overburdened, and people referred to dispensaries unless they were having trouble breathing. During this time, people were even punished if they were caught not wearing a mask in the capital city. These police are watching for people not wearing masks. Then cases began to taper off. On October 18th, the president of Madagascar declared the COVID-19 health emergency to be over. People are still required to wear masks and practice social distancing in public. Gatherings remain restricted to less than 200 people. Public, primary, and secondary schools are now open. The capital city's international airport is still not open for regularly scheduled flights. People continue to experience unprecedented hardship as they adjust to the severe disruption to their lives. Official statistics were reported daily at the beginning of the crisis, and now they are reported weekly. The report for November 7th shows 17,223 total COVID-19 cases in Madagascar since the beginning of the pandemic, and 249 deaths. In the week before November 7th, only 122 new cases and 5 new deaths were recorded. There have been less than 92,000 total COVID-19 tests performed in Madagascar. Economic consequences of the crisis are extreme, especially for people with low income who depend on today's wages for tonight's supper. A shop owner told us that people are now buying essentials in very small quantities, like half a cup of rice or 7 cents of cooking oil at a time.
How has COVID impacted the country's health system? COVID has disturbed the essential services offered by the National Health Services, especially supplying medicines and other needed supplies. Medical personnel had much work to do with not enough protective supplies. COVID has caused poverty to increase. The increase in poverty had made people more vulnerable to other diseases. We have seen an increase in chronic and acute malnutrition in children and women.
The COVID crisis has also been devastating for Madagascar's endemic plants and animals. This is for 2 reasons. First, tourism has plummeted to almost zero, so tourist revenue used for conservation is absent. Second, deforestation has increased greatly as people who are hit hard by the economic consequences of the pandemic are turning to the forests for means to get by, cutting trees to make charcoal, killing animals to get protein, and relying more on slash-and-burn agriculture for growing crops. As with all sectors, the FJKM has not been spared. Student pastors, and FJKM staff have had COVID-19, and some have died. The canceled church services and reduced income of members resulted in a huge drop in the FJKM's revenue. Unfortunately, all employees paid by the national office, over 300 people, have been on half salary since May. This includes central office staff, personnel from FJKM's 5 seminaries, and the 72 evangelists. Doug Tilton, PCUSA's regional liaison for Southern Africa and acting Africa area coordinator, is going to share PCUSA World Mission's response to the COVID crisis and to Madagascar specifically.
At the beginning of March, as the novel coronavirus began to spread around the globe at a dizzying pace, World Mission convened a crisis management team, which met daily throughout most of March to enable rapid assessment, response, and communication as new information emerged about the pandemic's spread. On March 10th, the PCUSA announced a travel moratorium for all staff, although mission personnel seeking to return home were accepted. 10 days later, after the U.S. State Department warned all U.S. citizens to return to their homes, World Mission asked all mission personnel to heed that advice unless they could provide good reasons for sheltering in place. Roughly 2/3 of mission personnel in Africa returned to the USA, often as their countries of residence were going into lockdown and airports were closing. These measures were ultimately extended, first to the end of 2020, and later to the end of June 2021, creating substantial hardships for many mission personnel who left their homes suddenly, expecting to return in a matter of weeks. However, most have been proactive and creative in setting up routines that allow them to remain in regular contact with partners and to do what they can to accompany and assist their colleagues in their countries of service. Many are also finding new ways to interpret their work and their partners' ministries to PCUSA constituencies, sharing inspiring stories from African partners, and promoting mutual learning through participation in webinars and virtual mission network meetings. All are working hard and discerning ways to adapt to this strange new world. Even before all of the mission personnel relocation issues were resolved, World Mission began reaching out to partners. The Africa Office regional staff contacted all of our partners in Africa to assure them of our prayers and solidarity, and to invite them to let us know how they were responding to the pandemic in their own contexts, and if they felt that there were ways that the PCUSA could partner with them in this work. We received 38 proposals from global partners in sub-Saharan Africa. A team of 6 mission co-workers with professional public health experience in Africa, including Elizabeth Turk, stepped up to help review the proposals and to suggest ways of helping them to conform to international best practices on the prevention of COVID-19 transmission. World Mission also collaborated with Presbyterian Disaster Assistance to make more than $400,000 available for COVID-19 responses in Africa. These included initiatives in 3 broad categories. First, direct provision of medical care. Second, community education and public health initiatives, including sanitation. And third, food security and nutrition. In Madagascar, we were able to send funds to the development department of the FJKM to support their plans to train doctors and nurses in 32 rural dispensaries in emergency responses to a range of medical needs, including COVID-19. A second grant helped SAF FJKM to educate communities on good public health and hygiene practices. The FUIBE, or headquarters of the FJKM, asked for funds for protective measures, such as digital thermometers, hand-washing stations, and hand sanitizer, and for spiritual outreach and encouragement via Radio Fazavana. and for nutritional relief for staff members who were not able to access adequate food. The Dorcasi Hostel for Female Students, Akani Gazela, asked for a small amount of assistance in order to improve hygiene measures in the hostel. And the Churchwide Committee on HIV and AIDS, KPMS, sought help to enable them to incorporate COVID-19 messaging in their public health awareness efforts. All in all, we were able to make close to $40,000 available to the FJKM during this period. I'd like to say a special word of thanks to all the PCUSA constituencies who support World Mission's work and our mission personnel through your prayers and gifts. A special word of thanks is due to those congregations who contributed directly to these efforts, particularly in providing relief to the Central Church staff. Thank you for making it possible to walk together with our sisters and brothers in this way. Please know that your sisters and brothers in Southern Africa are very much aware of the COVID situation in the United States, and they are also praying fervently for you.
As Doug noted, the FJKM was proactive in the midst of the COVID crisis. When worship services were canceled, FJKM officers and leaders came to the FJKM radio studio to record worship services. Often a special car would be sent to pick people up and take them home when public transportation was banned. All during Holy Week, devotions and worship services were provided by radio and TV to meet people's spiritual needs. Pastor Radu Bera, head of FJKM's chaplaincy program, and others in the chaplaincy program have been preaching and offering encouragement to vulnerable populations, including those waiting for COVID testing early in the crisis. The FJKM is also sharing messages about COVID through radio broadcasts, educating people about what needs to be done to protect themselves and why it is important. Many branches, like the Scouts, are producing and distributing masks and educating people about COVID. Among these is the FJKM AIDS Committee, with funds from PCUSA. FJKM seminary students and their families are among those who are receiving masks. 200 masks were also distributed to the members of the National Council who are meeting now. With funds received from PCUSA, FJKM's Development Department produced COVID-19 posters, flyers, and training materials. The Development Department trained 250 volunteers who worked for 3 months in the 4 districts hardest hit by the COVID-19, sharing health messages about COVID-19 prevention and treatment. It is estimated that 40,000 people benefited from COVID-19 awareness activities in the 4 districts, which also included radio messages in local dialects. The Development Department also equipped its 32 dispensaries with protective and cleaning supplies and educational materials. The FJKM launched an appeal to Christians and churches to share what they have with those less fortunate. Here is a collection that an individual FJKM church made to distribute to needy families, including the homeless. Many other churches have responded as well. The Miaru project, carried out by the Ministry to Marginalized People and funded by a Presbyterian Women grant, has been reaching out to those in need. With financial assistance from PCUSA, the FJKM AIDS Committee has distributed food relief to all 5 seminaries. In August, the FJKM coordinated a food drive to help those in great economic hardship. Churches and individuals in the capital city brought contributions to the central office for them to be bagged. About 3,000 bags were distributed through the synods to the neediest members of the church and community at large. Another example of reaching out during the crisis is the work the Fruit, Vegetables, Environmental Education Program, or FVEE, is doing. To help mitigate economic hardship from the COVID crisis, the FVE has a project to help low-income farmers near the Mango Palace at Matsinzu. The project provides face masks, soap, vegetable seeds, and a daily wage to farmers. In addition to outreach ministry, the FJKM felt a great responsibility to make sure that those working for the FJKM were properly protected. Funds were used to equip the national offices in Antananarivo with needed cleaning supplies and hand-washing stations. Each member and each office were given hand sanitizers and masks. FJKM faced a big funding gap for daily operations and paying its 330 national staff, which includes FJKM evangelists. First Presbyterian Church of Orlando, Peace USA, and the Outreach Foundation have all made contributions to assist the FJKM with this gap in the early part of the COVID crisis. The FJKM has yet to meet its funding gap, and staff are still on half salary and are likely to be so into the new year. Recognizing the hardship that COVID has caused the Malagasy people and the FJKM Church, the Madagascar Mission Network is seeking to raise $20,000 to assist the FJKM as it deals with the crisis that is affecting the church and the country. A portion of these funds will be used for outreach ministries to vulnerable groups. The FJKM would like to offer a COVID relief package to its national staff and retired pastors without a pension. All contributions are welcome as the Madagascar Mission Network seeks to come alongside the FJKM in this time of great difficulty. The pandemic has already had devastating effects in Madagascar, socially, economically, and environmentally. It is hard to predict how COVID will affect Madagascar in the future. Please pray for the FJKM as it seeks to lead and serve in these challenging times.